Hey everyone, what's up? This is Dr. Charlie PT. Hope you are doing well. Beautiful first day of fall here. And the topic of this video is do what's safe. All right, so I can't tell you how many people reach out to me every day and they do things that they've been told to do, yet they don't feel safe doing them. So if you're unsure of who I am, real quick, again, my name is Dr. Charlie. I'm a PT. I have my board specialty in orthopedics and I help people all around the world with back, butt, and sciatica problems. Back problems are a big issue in this world, and so my goal is to help synthesize what we know about back problems and bring it to people like you. Okay, so every day, that B really likes me, every day people reach out to me and they are performing exercises, let's just say, right, with the intent of trying to get out of pain or fix their problem, resolve their pain, right? But it doesn't feel comfortable when they do that, right? Yet the belief has been instilled within them that they need to do that thing which they're doing and that doesn't feel good, that feels yucky, to become pain-free. So case in point, all right? Woman reached out to me and said, Dr. Charlie, I need to get my glutes strong to get rid of this pain. That's what she was told, and therefore that's what she believed. But every time I do it, it's so painful. And so I said, well, why don't you stop doing that? And she said, well, I need to get my glutes stronger if I'm going to get rid of this pain. And do you see how we tend to ignore that which feels safest to us and ignore what our brain and our body are telling us about doing a specific thing because of something that we believe in, because of something that we've been told to do? And so we tend to buy into the narratives of others really quickly, other doctors, other specialists, professionals, experts in the area, because we're not doctors, right? You're not probably a doctor if you're watching this, or if you are, that's okay too. But maybe this isn't your specialty. I'm guessing it's not if you're watching this, right? And so we tend to trust those folks who are experts in this area to give us the best advice for us, right? And we tend to very quickly ignore our own intuition, our own gut instinct about, you know what? Is it really normal that after doing these stretches, I feel way worse? Right? You probably scratch your head and you're like, man, it just doesn't feel right. It just doesn't feel like this is working. But that's what I've been told to do, so I'm just going to keep doing it. All right? And so that might look like doing certain stretches, nerve glides. That might look like doing certain piriformis strengthening exercises, clamshells, bridges, back bends, McKenzie, McGill, name all the big players right in the space. Just because those people are smart. And they've probably done lots of good work to contribute to helping people like you with back, butt, sciatica problems, doesn't mean that you should ignore that which your brain and body are trying to tell you. Doesn't mean that you should ignore the fact that if you're doing something, it's making you feel yucky, it's making you feel unsafe, it's making you feel flared up, aggravated, and just feels like something's off. Take a moment from this day forward to really tune in and listen to yourself, all right? And to really challenge the narrative. What I have found, as somebody who used to fix lots of people, by the way, as somebody who used to fix lots of people with my hands, I could never feel what they were experiencing, right? So as I was cracking their back or something like that, their head would be this way and I'd be over top. If only I had a mirror or camera, right? I imagine they would have made faces at me so often. And so I found that I was good at fixing people with my hands, but people in pain were terrible at fixing themselves. And so I challenge you, right, to take control of your recovery. If you're trying lots of things, and you're relying upon lots of external treatments or things or people to try to fix you, look within and ask yourself, hey, what feels most natural? What feels best? Is it possible I've been told to do all these exercises by all these smart people? And it's maybe just not what's best for me? Right? And this is the interesting thing, because one treatment that works for someone else might make you much worse. And what makes you worse might work for someone else. And vice versa, or whichever way that is, right? And so at the end of the day, challenge you after watching this video, if you have some type of back, butt, or sciatica problem, which I imagine you do or you wouldn't be watching this, right? To really try to listen to the feedback that your brain and your body are giving you. If you're doing something that feels yucky, drop it. If you're going to someone and they're doing things that hurt so good, man, I go to the massage therapist, they dig that elbow right in my butt cheek, they give me the people's elbow, right? And I can barely walk on the way out to my car, but it hurts so good, and they said they could feel something. And so because that person's smarter than me or must know something that I don't, I buy into it. But do they really? Who knows what you're feeling better than you? Knowingly or unknowingly, you have created your pain experience. It is your pain experience. And so it actually puts you in a really powerful position, a position of potential power. Obviously, there's some tools and knowledge and some understanding, probably, that if you're watching this, you're trying to gain, right? But at the end of the day, it's your pain. And as, again, somebody who used to put my hands on a lot of people and fix a lot of people or attempt to do so, it worked really well in the moment, but the problem always came back because people, again, were not very good at fixing themselves. And so the results became much longer lasting for people like you when I was able to give you what I know. And then you were able to interpret that. You were able to find, like, hey, Charlie, this is a really good idea. Rather than telling me what to do, you're going to give me the tools, the concepts, the principle, the understanding of what I need to do. So this way I can find what works best for me. Because after all, you're the one in pain. It's your pain experience. No one else can feel it, regardless of what they tell you, regardless of whether or not they can tell you that your hip is this, or your one leg is longer, you're rotated, or whatever. None of that matters. They might think that they can tell that, and maybe they can. But there are many people who have those things and feel no pain. Maybe you do have a tight butt cheek when someone digs your elbow into it, but so do I. Nobody likes that stuff, by the way. That hurts so good stuff. It feels good in the moment when you're trying to get out of pain. Yucky in, yucky out. All right? And so every day, again, I work with people all around the world to help them use the power of their mind and movement as medicine to resolve back, butt, sciatica problems that haven't been resolved by doing other treatments. Many people who come to us have tried many different things. And so from this moment forward, again, I would ask and or challenge you to question that which other people are doing to you and ask yourself, does this feel intuitively good for me? Is this a yummy input? Is this something that intuitively makes sense? Right? Because if you think about it, does it really make sense? If you had a bruise on your arm, does it really make sense to poke it and stretch it and put an elbow in it, and jab it with needles? Does that really make sense? Is that the way that you would instruct someone if they had a bruise to go about letting that thing calm down? Probably not. Right? You would take a much gentler approach. And so I have found, after doing this for quite some time and specializing in this area, that less is more. And so if you have the right tools, you have the right information, that's obviously a stepping stone in the right direction, but at the end of the day, be cautious of working with folks who are very dogmatic. This is the way. There is really no way. This is what we know. You, as the person in pain, can plug these different inputs into the system. We know that your pain is an experience created by the mind first, which has an impact on the body. And so, ideally, you find someone who puts an emphasis on teaching you, not fixing you. Begin to challenge the narrative. Ask yourself, does this feel safe? Does this feel right? Does this feel good? And it doesn't matter how smart that person is or what they've done, right? At the end of the day, it really comes down to you. You being accountable and you really putting the effort and being willing to put in the time and the energy to do the detective work necessary to find that which works best for you. Okay? Now, I don't recommend a random process. There's a process that we teach people to help them optimize the healing environment, mentally and physically, to help them kind of track progress. You can't manage what you don't measure. We teach people how to use movement to create safety within the system. If every time you move it hurts, Well, you become fearful of movement. That's a problem. And then finally, coming up with a way to get back to life systematically versus, hey, you're out of pain, you're discharged, good luck. All right, so hopefully this was useful. Listen to your body, find that which is safe, and lean into those yummy movements, those yummy experiences. Yucky in, yucky out, yummy in, yummy out. That's all I got. Again, this is Dr. Charlie, physical therapist. If you are interested in learning the process or learning more about the process that we use to help people and kind of seeing how we take people who are in pain, lost, confused, back butt sciatica problems, and we help them get clarity, then be sure to check out the link somewhere above here where you can register for a free workshop that I've created. Just click, register, show up, we'll be there, and we'll walk you through the process that we use to help people become pain-free. That's all I got. Have a great weekend, everyone. Happy fall. Chat soon.